portion of the population or greater benefit with less harm. And we're not at all saying that expensive treatments aren't good. I mean, in some cases they've revolutionised care. For example, in my area of rheumatology, the new expensive drugs have really changed the outcome of people with conditions like rheumatoid arthritis. But what we really focus on in the book is treatment that is wasteful, that won't help the patient, often can harm the patient, and takes away resources and time from getting on with the job of treating people that do need medical care.
One of the things you talk about in the book is that benefits are overestimate, and doctors are really bad at balancing the harms, and they underestimate the risks.
And overestimate the benefit. Yeah.
Why does that occur?
Well, I think everybody does it. I mean, I think if you go and see, a Toyota dealer, they think the Toyotas are better than the other cars, and they probably really believe it. But other professions are the same, and it's been shown systematically in a review by researchers at Bond University that physicians of all types, surgeons, physicians, whatever, consistently overestimate the benefit that treatments provide compared to what the evidence actually shows, and consistently underestimate the harms of what they do compared to what the evidence tells us.
So there's systematic bias there. But the bias, Rochelle, goes beyond that. You've done research into a procedure called vertebroplasty, where they pump cement, if you like, into a collapsed vertebra to allegedly reduce pain. You've done 2 randomised trials that shows that it doesn't work. And yet you're vilified for actually coming up with the evidence that it doesn't work. Why does that occur? Is this because of money, vested interests, or just you're shaking people's egos? What's going on there? Sorry to rekindle a trauma in your life.
My trauma. I mean, I think all of those factors, there are many factors. If I'm being kind, the biggest factor is the lack of science literacy, the fact that people don't understand the evidence. So okay, it may not work in this group, but it works in this group. And when you've shown in 5 trials compared to placebo that a treatment doesn't work, then it really makes no sense that there would be a subgroup that it did benefit, because there'd have to be another subgroup that actually were harmed. And so I think that's a combination of wishful thinking, fee-for-service, erroneous beliefs, and inability to really appreciate and understand the evidence and be prepared to understand the evidence rather than go with anecdotal beliefs, particularly for conditions that get better quickly, whatever you do. So I don't think doctors, some doctors recognise that for these self-limited conditions, and it applies to things like tennis elbow and back pain, they get better in their own time, and treatment really doesn't influence that time course. It's just at random, probably.
And one of the things you have a go at in the book is treating by numbers, which comes to the chapter and the part of the Hippocratic Oath. I'm not treating a fever chart, a cancer growth, but a patient, Ian.
Yeah, there's a good term for that, the normalisation heuristic, where there's this strong tendency for us to measure things and then to normalise them. So, whether that's a blood pressure or a glucose level. Now, of course, there's times where that can be very helpful, but there's examples where it's actually harmful to do that. In blood pressure, by lowering the threshold, the way some recommendations have recently, you're going to get to the situation where nearly half the population has high blood pressure. And the more you lower the threshold, the less benefit you give those people who are on the borderline, but they're still exposed to the same harms.
It's a big book. People are going to get lots of from it. But briefly, I mean, what are doctors to do about this? Apart from, we'll talk about consumers in a minute. We've only got a short time to go. But what are we to do about this?
Well, I mean, starting at the base level, I think we need better medical education. We need to have continued medical education through the career course of doctors, so they actually understand evidence and science scientific principles of clinical epidemiology. And, everybody's an epidemiologist now, so it's a good time now perhaps to think about critical appraisal skills. And I think that's essential, and it's got to be combined with better communication and giving patients the permission to ask them questions about the evidence.
And you quote the right questions to ask your doctor in the book, and also presumably governments have got to get rid of the perverse financial incentives. Look, thank you very much to you both. Good luck with the book.
Thanks very much, Norman.
The book's called Hypocrisy, University of New South Wales Press, and the authors are Rochelle Buchbinder and Ian Harris. Over to you, Tegan.
Well, as we head into the warmer months and lockdowns begin to lift in the southeastern states, more people will be getting out and about, including on bushwalks. But where there's bush, there might be a snake or two. And some of our snakes, like the eastern brown, are among the most venomous in the world. So what do you do if you encounter a snake, or worse, get bitten by one? Dr. Christina Zdenek is a toxinologist at the University of Queensland and an expert in snake venom and behaviour. She's also one of the ABC's top 5 scientists for 2021, and she's put together this story on what to do if you get bitten, what happens at the hospital, and the mistakes doctors can sometimes make when treating snakebite. And a heads up, the first thing you're going to hear is an actual recording of Christina getting bitten by a snake.
Okay. Oh.
Damn.
Did he bite you?
I think so.
Oh, you're kidding me.
No, I got him.
Hang on, you've been bitten.
Yeah. Sorry, guys. Really sorry. All right. First aid. Yeah, you got me.
Oh, yeah, you got you, all right.
Is this your first bite?
Yep. Just try to calm myself.
Just relax. Nothing's going to happen.
That was a bad angle. That's what went wrong.
Yeah, I know. You had it too far down in that split second.
Yeah. And now immobilization.
Yep.
This is the audio of when I was bitten by a highly venomous dugite, a type of brown snake from the Perth region. My first reaction to being bitten was to apologize to those in the room for ruining their evening and stressing them out. It's a stressful situation because it is a medical emergency.
Can we do anything for you? Call 911?
No.
And you can die as a result if you do the wrong thing after being bitten.
Got my hand out nice and straight.
As I was being bandaged up, my mind wandered to how exactly the toxins in the venom would act on my blood, because this is precisely what I research. Literally, I was imagining the toxins flowing through my blood and starting a domino effect to cast a net around the red blood cells to cause a clot. Then I thought, damn, I've gone 10 years of snake handling without a bite, and now my perfect track record is buggered. Without proper snakebite management and antivenom treatment, brown snake bites can make you collapse in just 15 minutes and cause death within 30 minutes. They're one of the fastest killing snakes in the world, but we did everything right and the hospital was nearby. I'm still embarrassed to admit I've been bitten by a venomous snake. Part of my job is to handle these venomous snakes for field studies where I track their movements or do lab studies looking at snake behaviour. At home in my Brisbane townhouse, I have 26 pet snakes, 16 of which are highly venomous. They all need cleaning and feeding fortnightly and are used in snake handling courses and for venom extraction. So we're heading into the warmer months, which means lockdowns or not, more people will be out and about, and so will snakes. And if you come across a snake, you want to know how to avoid getting bitten. Well, the best advice I can give you is to give them space. Snakes are cowards. They're terrified of us. We are huge predators to them. They'd rather bolt away than fight. A super cool and elegant study tracked both humans and snakes and recorded the reaction of snakes when encountering these people. Less than 1% of snake encounters resulted in a strike. Although it's unlikely you'll encounter a snake, wear shoes just in case, because snake bites often occur on the lower legs. So what if you are bitten by a venomous snake? How do you survive? As always, we have a lot to learn from First Nations people. The Jangga people from inland Queensland survived by simply lying down under a tree, staying completely still for 4 to 5 days. Their mob, of course, looked after them with food and water. Nowadays, we have modern-day medicine, antivenom. In the 1930s, 40s, and 50s, Australia's 6 snake antivenoms were developed. We actually led the world. And most of our hospitals have good stock. Some remote hospitals don't, but we have the Royal Flying Doctors. They actually saved my husband's life when he was bitten by a snake in the Northern Territory. He's a professional snake handler too. But the key to surviving a snake bite actually comes before getting to hospital. So I'm going to tell you what to do immediately after you've been bitten. The common thread between most snakebite deaths in Australia is a failure to manage the snakebite correctly. So you stay still, like First Nations people did. Literally don't move a muscle. Basically, the more your muscles contract and the higher your heart rate, the quicker the venom travels through your body and does the damage. The second thing you need to remember if you're bitten by a venomous snake is to apply a compression bandage to the limb. Similar to how you would a sprained ankle, and starting from the end of the limb, working your way all the way up, using a second bandage if needed. Then immobilize the limb in a splint if possible. The compression bandage is critical because it buys you time by slowing the venom flow through your body. If caught without a bandage, I'd be using my clothing instead. So the bandage delays the venom from entering the blood. Venom in the blood is bad because the blood then takes the venom all over the body, except the brain. I'd also say this. Once at the hospital, do not let the medical staff remove your compression bandage quickly. My husband nearly died when the doctors removed his bandage too fast, because in doing so, it opened up the floodgates for the death adder venom, sending his body into shock. He was in a coma for 3 days. Fortunately, antivenom saved his life. Doctors rarely treat snakebite in Australia, so I'm guessing that's why they mightn't know to take the bandage off super slowly, like over the course of an hour. It should be removed in sections, starting from the top down. This lets the venom enter the body at sublethal doses, giving your body a chance to fight back and not be overwhelmed. Antivenom should also be on hand before the bandage is removed. When I was bitten by the brown snake, the one I told you about earlier, my arm was bandaged within 30 seconds, and I was at the hospital in 8 minutes. I actually recorded some of that audio.
As you can see, the brown well there has also gone blue, meaning that she definitely has brown snake venom in her. So she will now proceed to a major hospital, but you'll be right.
Right, so I'm in the Logan Hospital, 3.5 hours post-envenomation. I haven't seen a doctor yet, and still asymptomatic, which is a good sign. Still waiting to hear the results of my blood test. And I have insisted on a second blood test because the venom would have travelled further by now. All right, good news. I'm out of the hospital. It's 18 hours post-bite, and Chris is here to pick me up. I had some really low blood pressure and heart rate, and they were a little concerned about that. But yeah, basically dodged a bullet, hey?
Definitely. Could have been a lot more serious than what it was.
Yeah.
So no, very lucky.
Now it's time to tell Mother. She's
Yes.
not going to be happy about this.
No, she's not.
We'll tell her after everything is okay.
Absolutely, that's the way to go.
So, prevention is better than cure. Avoid a bite by giving snakes space. If you do get bitten, it's how you manage your snake bite that will determine if you survive. I survived my bite, and my husband did too. And so can you, even if it's the world's most venomous snake.
University of Queensland toxinologist Dr. Christina Zdenek, one of this year's top 5 scientists with ABCRN. And there's more information on how to handle a snake bite on the Health Report website. Norman, I met Christina during her top 5 residency. She has a pet snake called Netflix.
Oh, God.
But I'm not sure Netflix has ever bitten her.
I was sort of very agitated as I was listening to that.
I feel empowered now. I do bushwalk quite a lot, and I always carry a snake bite kit with me because it's a risk that we take.
Yeah. I remember bushwalking in Sunshine Coast along the national park, and there was a brown snake lying on the path, and people were just standing over it, looking at it and having a conversation about it. And,
Nah, turn around, walk the other way, I think.
yeah, people in their bare feet as well. Anyway, that's another story.
Well, if you've got questions about snake bites or other things, you can email us healthreport@abc.net.au. We've got a nice crop of questions this week, Norman, because it's been a week or two since we've done the mailbag.
Mm-hmm.
First question comes from Bernie, who is a 62-year-old non-smoker male, and he's talking about gum disease and its relevance to heart disease. It's something that we've talked about some years ago now, and he's sort of wanting to know what the latest is on the degree of disease required to elevate your risk of heart disease. Basically, Bernie's got a dodgy tooth that's giving him a bit of pain, and his dentist wants to pull it out. He's wondering if it's gum disease or nerve damage causing his discomfort, and is there any way to know for sure if there is disease?
Well, your dentist should be able to diagnose periodontal disease. As I've said before on the health report, what I know about dentistry could be written on the back of a molar, a very small molar, a child's molar, not an adult molar. But I do know a bit about periodontal disease, and so gum disease and heart risk. This is controversial. So there have been studies which show that people who have chronic gum disease have elevated risk of coronary heart disease. But there's also other stuff that goes along with periodontal disease. I'm sure it's not you, Bernie, but people who smoke, who have a poor lifestyle, that goes along with periodontal disease. Previous poor dental hygiene, which goes along with poor lifestyle. So it's very hard to unpick the periodontal disease itself from the lifestyle that goes along with it, which is not uniform. It's absolutely not uniform. But what you describe in terms of a single tooth and a problem there and it being irritated is that there's reasonable evidence that if you've got a site of inflammation in your body, it does activate your immune system and can cause collateral damage elsewhere in your body. So there is an argument, and I'm not giving you advice here, you take it from your dentist because your dentist knows what he or she's talking about and I don't. But there is evidence that if you remove the infection, a chronic source of infection, that you actually do help to deactivate your immune system, and therefore it's not on alert. For example, if your cholesterol's up a bit and you've got an overactive immune system, this is the theory with periodontal disease, then you're more likely to get inflammation in your arteries. When the cholesterol comes in, that inflammation helps to cause atherosclerosis. So it's a good idea, particularly, you're pretty young, 62, when you're getting on